5 lessons I learned while working in a psychosomatic clinic in Germany. Hello and welcome. My name is Estelle Beck. I'm a medical doctor living and working in the beautiful town of Baden-Baden in the south of Germany. And I've had the privilege of working in a psychosomatic clinic for almost a year now, and I've learned some really incredible lessons that I want to share with you. Lesson 1, sleep. The most common complaint I hear in intake interviews: problems with sleep. I would say about 90% of the patients that I interview when they first come to our clinic have trouble falling asleep, staying asleep, or wake up far too early. And sleep is just a fundamental basic of our mental health. Lack of sleep, as I'm sure you've experienced yourself, affects everything: energy, memory, mood, concentration. We need good sleep patterns for good mental health. Sleep is the time when our body and our brain regenerates. It's the time when we heal. Make sure that you get enough quality sleep every single night. Lesson 2, which was really a surprising lesson for me, I didn't expect this, but it became really apparent, and I experience it regularly with my patients. Community heals isolation. It might sound quite logical, but when you welcome new patients into the clinic who've really isolated themselves because of anxiety or depression, it can be really scary for these patients to come into the community of the clinic and into the group of patients on the ward. But within about a week, I can see changes in patients. They start gathering together. They will cook together. They go for walks together. They laugh and they joke together. They puzzle together and they spend time together. We are social beings. We are meant to be in community. We are meant to be in different groups, and we are not meant to suffer alone. My message to you: if you're feeling sad, if you're feeling anxious or depressed, reach out, go out, as difficult as it is in that moment, but it's so important to connect with other people. Lesson 3, group therapy builds belonging. Group therapy can be scary at first, but I've experienced firsthand again and again how powerful it can be. And even though group therapy is something constructed in the clinic, it's actually something that we naturally do all the time. We are always part of a group. You can see your family as a group. You can see your work colleagues as a group. Even standing in a queue is a kind of a group. So we're always experiencing different groups. And the wonderful thing about group therapy is that you're in a group that may have experienced similar experiences to you. And it's kind of a safer place than perhaps other groups in the world, where you can share experiences that you have made in life and emotions that you're experiencing. And it's a very beautiful place to go in resonance with other people. And it's a wonderful feeling for a patient when they've been courageous enough to share something, to have the other group members nod in acknowledgement and understanding. Up until this point, I was always quite skeptical about group therapy until I was allowed to lead a group for a year. And it was an incredibly humbling experience, because I realized that it wasn't about me as a therapist. It was about the group dynamic. It was more about holding the group and creating a safe space. And after creating this safe space, the group actually functioned in and of itself. And I believe that is possible because we are group creatures. We are social individuals, and we want to be in a group, but we want to be in a safe group. And when we are in a safe group and we can just be who we are, that is when we can be happy and when we can be healthy. So my message is, find a group of people, family or friends, where you can be yourself, where you can be authentic, because that is incredibly healthy for you. Lesson 4, healing takes courage. Healing is not a passive process. It requires active courage, and it's hard work, quite honestly. We need courage to admit that we're struggling. We need courage to go to the doctor and say, I need help. It needs a lot of courage to go to a clinic and ask for help. It needs a lot of courage to admit to people, to family and to friends, that you are in a clinic, that you do need help, that you are in therapy. And a lot of times patients are ashamed that they're asking for help, but I always say it's the most courageous thing you can do, because it means you're taking responsibility for your mental health. You're stepping forward and you're ready to learn, and that is in itself so courageous. It also takes courage to look within yourself, to see negative patterns, to see behavior that is harming you. It takes a lot of courage to look at yourself in the mirror and admit to things that are not that great and that need to be changed. And then it takes a lot of courage to change them. But I am a firm believer that we all have that courage within ourselves. It's the process of finding the reason why. Why do you want to change? What life could you have if you decided to change? It's this courage that is just fundamental, and I think requires a lot of respect for oneself and for others. This is the kind of courage I see with my patients every single day, and I know how hard it is. I know how difficult it is, and I really admire them for it. Lesson 5, and probably my most important lesson: emotions are the bridge between your body and your mind. This to me is the heart of psychosomatic medicine. We often label emotions as bad or good, but these are just labels that we give them, because emotions have no inherent negativity or positivity. They are signs and symptoms of something that is happening inside us. They are a form of communication. And sometimes they feel good and sometimes they feel bad. But it's not about that feeling. It's about what they're actually trying to tell us. Emotions are trying to tell us what is happening inside of us. They are the language between our body and our minds. And with these emotions and these feelings, we are able to gather information. They are the language that the body uses to speak to the mind. In my experience, most patients that come to us don't have a good connection between their bodies and their minds. They have emotions that they can sometimes understand and work with, but most often than not, the more difficult or the bad emotions cause a lot of trouble because they remain in the body. We feel them as a really icky feeling, and that's it. That's where the process stops. And the incredibly important part is to acknowledge, wow, I'm feeling something right now. I feel sadness or I feel anxiety. Why do I feel that? What does it mean? What can I do with this feeling? What does this feeling mean in the greater sense in my life? And this process is just, it doesn't happen for a lot of people because we're taught as children that certain emotions are bad. So feeling angry is bad. Don't feel it, push it away. Being anxious or sad or moody, bad, bad, bad. And so by pushing these away, we are encapsulating these emotions in ourselves. And there's this kind of volcanic eruption going on in there. And we're completely overwhelmed because we don't know what's happening. And that's actually the crux of the matter, because this stress inside of the body needs to find a way out. And that's actually where we start having chronic headaches or chronic backache or chronic something else. And it's really about finding out, what am I feeling right now? Where am I with this emotion, and how can I deal with it? And that is the most important thing that I've learned in this year in the psychosomatic clinic that I've been working in, because It's even made me aware of emotions that I'm having that I've pushed away, and actually allowing them to surface and giving them space has been incredibly healing. And I think everybody should learn how to do this. So these are the 5 lessons that I've learned in psychosomatic medicine. If you've liked this video, please let me know in the comments or give me a like. I'd love to hear from you, and I hope to see you again soon.